that the committee reported favorably to the House. The clerk will report the bill.
H.R. 3-4.
Without objection, the bill will be considered as read and open for amendment at any point. The chair now recognizes the gentlelady from Wyoming, Ms. Hageman, for an opening statement.
Thank you, Mr. Chairman. I speak in favor of H.R. 3492, the Protect Children's Innocence Act. Mr. Chairman, today we are facing one of the greatest crises of our time, child abuse disguised as medical intervention. Children are being coerced by adults in positions of authority into life-altering gender transition procedures without a full understanding of the meaning or impact. Democrats have embraced an extreme position on gender and the biological differences between boys and girls and men and women. They are clearly more interested in promoting radical leftist policies than protecting children from harm. The radical left has deliberately distorted the public debate surrounding what they refer to as gender-affirming care, which is really nothing of the sort. Instead of accurately describing the procedures as harmful, life-altering, and barbaric, which they are, the left deceptively frames the procedures as being necessary to improve the health and well-being of children. By advocating for these procedures and this level of medical intervention, Democrats are indoctrinating children and encouraging them to make life-altering decisions about their body involving hormones and surgery, jeopardizing their health. Let's call this for what it is. So-called gender-affirming care is the genital mutilation and chemical castration of children. It is not life-saving care, it is child abuse. All evidence points to the fact that these barbaric procedures, including puberty blockers, hormones, and surgeries, are a form of genital mutilation. More and more individuals who were convinced to go down this road are now coming forward to share their horrific experiences of being used as experiments of the medical establishment. The majority of these brave individuals are girls and women. The first rule of medicine is do no harm, yet those in the medical community performing these grotesque procedures on children are committing serious harm. Thankfully, doctors across the United States and in other countries are also beginning to take a stand against those in the medical community who insist that these are, quote, life-saving procedures and should not be questioned. Thankfully, my friend and colleague, Representative Marjorie Taylor Greene, stepped up and introduced the Protect Children's Innocence Act. I thank Representative Greene for her important work on this legislation and for her tireless efforts to protect our children from this evil. The Protect Children's Innocence Act will hold those accountable who perform or attempt to perform genital mutilation or chemical castration on children. The bill expands covered offenses to include the bodily mutilation and the chemical castration of a minor. Victims are protected by ensuring that they cannot be arrested or prosecuted if one of these or other prohibited procedures are performed on them. This issue is really quite simple. Do not force children into making decisions they will not be able to reverse. Do not make these children lifelong patients dependent on the medical system. A civilized society protects its children first, and that is what this bill does. In short, do not abuse our nation's children. I urge my colleagues to support this legislation, and I yield back.
Gentlelady yields back. The gentleman from Maryland is recognized.
Thank you very much, Mr. Chairman. We know that one of the basic tactics in every authoritarian's playbook is to pick out a small minority group in society and scapegoat them, castigate them, demonize them, deny them basic rights and freedoms, dehumanize them, deny their very existence. Jews and Gypsies in Nazi Germany, Christians in Pakistan today, African Americans in Jim Crow America, gay people in Putin's Russia, Uyghurs and Tibetans in China. Just pick out a minority and mobilize the society against them, and you won't have to answer tough questions about your own authoritarianism, your own corruption. Mr. Chairman, I had a very disturbing meeting at the beginning of this Congress with parents of transgender kids who came to see me from my district. And I was prepared for them to be lobbying me on this or that, and I began to talk about different legislation, and they said, no, we know that you're with us on the legislation. We're here to ask you how far you think this campaign is going to go, because a lot of families have started to leave the country and are talking about leaving the country. going to Spain or Portugal or France, somewhere where their families can feel safe. And so I was so taken aback by the conversation and their true alarm and what they're reporting about their kids that I have followed this issue very closely since the new administration started. And indeed, the campaign of demonization and vilification and scapegoating began on the very first day in office. President Trump issued an executive order denying the very existence of transgender Americans. That's an order that George Orwell would have recognized well. He purged government websites of any reference to transgender Americans, just disappearing them. He issued an executive order directing that Americans serving honorably in the armed forces for years or decades be summarily kicked out for being transgender. That's right, a guy who avoided military service himself because of his serious problem with bone spurs and who told Howard Stern that his Vietnam was trying to avoid sexually transmitted diseases at the discos and clubs of Manhattan, is now kicking out of the military thousands of honorable, patriotic Americans, more than 1,000 at least, who've already been kicked out, people who have faithfully and bravely served their country because of Donald Trump's intent and determination to scapegoat these people. He's threatened to defund schools just for supporting trans students. He's trying to bully schools into banning trans girls from playing sports with other girls. And understand what the Biden policy was. The Biden policy was to leave it to the school districts. No categorical ban on transgender kids across the country, across different school districts, but it's up to each elementary school, middle school, high school to work out those issues for themselves. Trump's ordered transgender women incarcerated in women's facilities to be immediately transferred out and placed in male facilities, putting their bodily safety into jeopardy. Today, during Pride Month, no less, which is not to imply that our colleagues are necessarily celebrating Pride Month, but our colleagues go one step further now in this cruel campaign. They seek to deny transgender youth access to potentially life-saving health care, access to the treatments and medications prescribed to them by their physicians in accordance with the wishes of their family, their parents. And they do this while they try to pass the big, beautiful bill that will cut health care to more than 14 million Americans. For the life of me, I don't understand how a party which prides itself so much on the individual's right to make his or her own decisions, the family's right to make the decisions for their own kids, so much so that they would reject the obligation of anybody to get a vaccine in the country at this point for any purpose. I understand it's a principled position. Now you want to say that you're going to make a decision for a family and their kids about how they're to be raised and what health care they need? Big Brother loves their children more than they do? Is that what you're telling us? I mean, give me a break. The so-called Protect Children's Innocence Act, introduced by that famous advocate of public health and children's safety, Marjorie Taylor Greene, would make it a crime for doctors just to care for their transgender patients in accordance with the wishes of their families. All major medical associations in America agree evidence-based gender-affirming care is necessary and in many instances life-saving for transgender youth. And while my colleagues across the aisle today will likely tell you there are young people across the country being mutilated by evil, malicious doctors, that is not the real story. Like all medical care, gender-affirming care is tailored to the age and the unique needs of individual patients in consultation with the families, medical doctors, mental health professionals. And I'm sorry, I trust them more than I trust Marjorie Taylor Greene, who has shown nothing but a spectacular disrespect for scientific professionalism and expertise in the United States of America. Let's not turn the Congress of the United States into a supreme medical board for the country that will override not only the states and the localities and the medical associations and the physicians, but even the wishes of the parents. I wish one of my colleagues would explain that to me, how you expect Big Brother to make better decisions than the families of the kids involved in this situation. It is to elevate your ideological dogma over the needs of real people. Let's stop attacking transgender kids. Let's instead fight to support the programs all of us need. My colleagues voted for a bill that threatens health care for over 37 million children who rely on Medicaid and CHIPS, the Children's Health Insurance Program. They supported cutting benefits for nearly 15 million children who rely on SNAP benefits to get adequate nutrition in America. They want to gut the Department of Education, which ensures nearly 26 million low-income students and 7.5 million students with disabilities will have access to meaningful educational opportunities. If we want to talk about children in America, let's talk about children in America. Let's not demonize and scapegoat less than 0.5% of the population. Somewhere around 1 million people in America are transgender. So let's not pounce on them and demonize them and vilify them and the people who love them and who are trying to take care of them. This so-called Protecting Children's Innocence Act from Marjorie Taylor Greene is the latest effort to attack, demean, scapegoat transgender Americans. I won't stand for it. I urge all of our colleagues to oppose this, and I yield back.
Without objection, all other opening statements will be included in the record. The chair now recognizes the gentlelady from Wyoming to offer an amendment in the nature of a substitute.
Mr. Chairman, I have an amendment at the desk.
The clerk will report the amendment.
Amendment in the nature of a substitute.
Without objection, the amendment